Hello all, welcome to the All In for Kansas Kids biweekly webinar for August 10th, 2022. And I know many of you might have got your littles off to school today. So that's very exciting and stressful if you've got that going on. I hope your week continues to go well. We're really excited this week. We're going to have a presentation, an additional presentation from the Child Care Health Consultant Network. If you remember, we hosted them a few months ago, and so we are going to get additional information from the Child Care Wear team about some of the additional functions of the Child Care Health Consultant Network, in addition to just some general system updates about what's going on in our infrastructure, including some resources for providers, as well as professional development opportunities. Just a few days left on the Sunflower Summer apps. So if you've not looked at these, they're very cool. It's free admission to a lot of attractions throughout Kansas, like the Cosmosphere, the Oz Museum, the Natural Living History Museum here in Topeka is included as well. You can download the app on the App Store for Apple users or the Google Play, and it ends August 14th. So it's one free visit for caregiver or parent with children to any of these really cool opportunities. And again, it's completely free. So if you haven't checked that out yet, please do so. It goes away August 14th. So we've got one more weekend to enjoy those attractions. Another really great resource that is very relevant right now is the Kindergarten in Kansas booklet that is put together by the Kansas Department of Education. And so it's just a really wonderful resource for families, caregivers, any interested party. If you have somebody that's preparing to go into kindergarten, you can get a mailed copy. There's a link that's going to be provided in the chat. And that paper copy or mailed copy is available in English, Spanish, Vietnamese, Swahili, Arabic, and Burmese. Some of the things that you can find in that booklet are checklists, like preparation checklists, as well as just some things to consider if you're making that transition with somebody that you love to kindergarten, because it can be a little bit overwhelming. So check that out. Links are going to be in the chat. If you'd like one mailed to you in any of those languages, or if you'd like to just check out the online link. And again, we hosted here a few weeks back, Child Care Aware of Kansas came on and did a wonderful presentation about some of the high level principles of the Child Care Workforce Appreciation bonuses, including when different program types would be available to go ahead and get that bonus. We were notified via the All In for Kansas Kids email last week that the application for center staff is now open. So if you've not gone onto the Child Care Aware of Kansas website and looked at those resources to figure out if you're eligible or how to attain your bonus, I encourage you to do so. You should have been notified by now if you were eligible. And again, these are one-time bonuses in the amount of anywhere from $750 to $2,500. And these provider bonuses are going out to more than 20,000 people in our workforce, which is really incredible. But if you have questions, there's FAQs on the Child Care Aware of Kansas website. There's also full recorded webinars with information and just answers a lot of questions. So check that out. Best place to go is their actual website. Also, if you're preparing for kids to come back, or for those of you who may shut down during the summer, and now just dealing with this, the infant formula shortage, the U.S. Department of Health and Human Services has provided lengthy guidance and help about what you can do in this situation, either how to transition a child from one formula to another and how to kind of slowly go through that process where it's not disruptive for the child, and some other ways that you might be able to locate formula for your own infant or maybe an infant that you provide care for. So if you'd like to check that out, Megan's going to be putting that link in the chat. I found it to be very helpful myself. So the GWC conference, which is one of the largest provider conferences in the area, which is hosted by Child Start in Wichita, is having their conference in April of 2023. So we're a little bit away from that, but they're trying to put together some presenters So if you're interested in presenting, you can follow the link that will be provided in the chat. And there's a bevy of topics that are approved to speak about. And so I would encourage you to check that out if you're interested in presenting, and see if one of those topic areas is something that you like to talk about, or have a wealth of knowledge about, but they really are looking to find more presenters. There's some benefits to presenting, including some discounts for registration, etc. But just in general, as an attendee, this is a really great networking opportunity for providers. It's got pretty high attendance, over 300 providers typically, or 300 attendees typically. And it just, a lot of cool stuff going on, workshops, networking, prizes, etc. So check that out. But if you're interested in presenting at the GWC conference in April, please go to the link and look at the approved topics. And then you can also make suggestions if you see an area of interest that's not already listed. Some other upcoming conferences that we have in the area. So NACY's annual conference is going to be in Manhattan, October 7th through 8th. We're going to give you more details for registration and agendas and things like that when we get them. That is what we know right now. The Kansas Breastfeeding Coalition annual conference and meeting will be in October in Wichita. And again, we will be happy to share any registration information, anything that they pass to us, we will continue to tell you about. And then Child Care Aware Leadership Institute is going to be convening in Tacoma, Washington this year in November. So lots of really cool opportunities if you're interested in that kind of thing. And again, the sustainability grants round 3 are open again. And this round has accepted applicants from March 1st to November 30th. And just as a reminder, these grants are non-competitive. So the parameters for application are intended to be easy. There's a lot of technical assistance and support. There's interactive assistance on the Child Care Aware website if you have questions. So if you are eligible and you have not applied for one of these sustainability grants yet, I encourage you to do so. The process has been made very user-friendly, and there's a lot of people that are willing to help you along the way. So I would say check out the link and see if you qualify and if that's something that you're interested in. So as of July 1st, at our full Kansas Children's Cabinet and Trust Fund meeting, the Kansas Children's Cabinet and Trust Fund began matching dollar-for-dollar investments for Dolly Parton Imagination Library programs throughout the state of Kansas. So as the state affiliate, the trust fund we're just going to do everything that we can to encourage other partners to start their own imagination libraries throughout the state, so we can kind of decrease the amount of deserts, if you will, that exist where children are not eligible to get those free books. It's a fantastic literacy intervention. And if you haven't looked yet, you absolutely should. If you go to the Dolly Parton Imagination Library website, you can look to see where the closest affiliate is and sign up through that link for maybe your grandchild or your own child or somebody that you're a caregiver for. There's parameters and it explains it very well. But it's just a program that helps expand literacy to every child in Kansas from birth to 5 if they fit in one of those available areas. And then if you're interested in starting a program in your area or becoming an affiliate or a partner, you can always email Pam Hunsaker at the email address provided, and she can answer some questions that you may have about how to go about that. And this is another really great women's economic and civic leadership opportunity. It's a town hall that's going to be hosted virtually statewide on August 24th from noon to 1 p.m. There's a link in the chat for virtual registration. And if you're able to attend, then you'll be given a $10 gift card for your time. But just a really great conversation about barriers that specifically impact women in the workplace and how it affects our ability to be entrepreneurs and accrue resources And so that's a very relevant conversation, especially for childcare providers. We know that there's a lot of barriers, especially being predominantly women and predominantly women of color. So really great conversation to be a part of. And again, the virtual opportunity is Wednesday, August 24th, noon to 1. It's free, and you can get a $10 gift card for your attendance. And Megan will put that link in the chat to register. And again, if you haven't looked at this, the parameters for the workforce appreciation bonuses, please go ahead and do that. The best place to do it is the the Child Care Aware of Kansas website. All of the resources are in one place there. And so instead of just reiterating the parameters here, and again, we just got notified that center staff has become eligible. Their eligibility period started as of, I think, like 10 days ago. It was over a week, but please check that out. And at this point, I'm going to turn it over to our partners over at Child Care Aware of Kansas to give us a presentation about some of the additional functions of the Child Care Health Consultant Network and ways that we can benefit from their services here in our infrastructure.
All right. Well, hello, everyone. Thank you all for having us. It's a pleasure to be here. We work for Child Care Aware of Kansas as the Child Care Health Consultant Network's specialty consultants. We're here to talk with you about our work as the Emergency Preparedness Consultant and the Health Equity Consultant. Next slide, please. The Child Care Health Consultant why can't I say that? I can't get it out. I'm so sorry. The Child Care Health Consultant Network has grown since we began in September 2020. We now have startup and recruitment consultants who work with new early childhood education providers as they become licensed and establish themselves as new programs. Our health, safety, and wellness consultants continue to work with already established licensed providers through their health, safety, and wellness needs. And we have four specialty consultants that work with providers around 3 specific specialty areas. Along with emergency preparedness and health equity, we have nurse consultants that specialize in helping providers with things like illness and exclusion policies, immunization schedules, and much, much more. Next slide. So now I will pass the baton over to my amazing teammate, Rachel Fisher, our emergency preparedness consultant, who will tell you more about her role in that position.
Thank you, Ms. Bridget. And like Ms. Bridget said, I am the emergency preparedness consultant. And I just want to share a few ways that I can help you in your program. So child care facility regulations require you to develop an emergency plan for the safety of children and staff in emergencies such as fires, tornadoes, storms, floods, and serious injury. The plan should be posted in a conspicuous place in the facility. The emergency plan should be shared with parents and legal guardians of each child enrolled. And each person caring for children, including each substitute, is to be informed of and shall follow the emergency plans. The required plan should address the types of emergencies likely to occur in or near the facility, including a fire, weather-related events, missing child, chemical release, utility failure, acts of violence or terrorism, or other situations that might require evacuation, lockdown, or shelter in place. So there are 4 main types of hazards. A natural hazard are the events such as floods, earthquakes, winter storms, wildfires, or tornadoes. Technological hazards are events caused by a malfunction of a structure and or some human error in controlling or handling the technology. Gas leaks, so that would be your gas leaks, power and water outages, dam failure, industrial explosion, nuclear plant leak, or hazardous material. Biological hazard is a substance that poses a threat to the health of primarily humans. So that includes the contaminated food outbreak, infectious diseases, or toxic materials. Safety or man-made hazards involve an element of human intent, negligence, error, or failure of a man-made system. So that would be your active shooter, bomb threat, criminal activity, cyber attack, and intruder. Next slide, please. So what can we do to help providers? We understand that focusing on all the hazards your program can encounter can be overwhelming. So together we can complete a risk matrix to determine which hazards pose the most risk in your area and help you prioritize your planning and your preparedness. We can help make an emergency plan with different response options and include children and adults with all levels of abilities, such as children in wheelchairs or with walkers, adults or children with sensory impairments, children with supplemental medical devices, food allergies, and safe transportation of medication that require refrigeration. And we can also help facilitate practicing those drills. We can give you information to connect with local resources and gather first response agency information like your county's emergency management team, local police department, and your local fire department. We can help plan for utility outages and show you how to use emergency shutoffs, including electricity, gas, and water. You should also train your staff on how to use those shutoffs and have it marked on your evacuation map in case you're away from the facility. And also having those utility providers, their contact numbers posted. We can help practice responses to a variety of hazardous scenarios. So like active shooter or flash flood, just to name a couple. We can help with a written schedule to keep you on track of things like your CPR and first aid trainings and your drills. So remember, drills should include all ages of children, every employee, every volunteer, and should be done at varied times of the day. You should update your plan after a drill or a real emergency. If you have changes in your facility size, changes to evacuation or shelter sites, or changes in state or licensing requirements. And with school starting, now is a perfect time to update your prep and practice your drills. We can help with developing communication and reunification plans. You know, without communication of the plan, parents don't know what to do and where you are. First responders may not know where you are. Staff panic and children are unprotected. So developing a family communication and reunification plan so families can stay connected is one of the most critical components of protecting children in an emergency. So we can develop a communication plan, and then a backup plan, and then a backup for the backup plan. And lastly, we can help assemble emergency equipment and supplies and discuss where to store them and what transportable and durable containers work best. So emergency kits should be placed in an easily accessible location on each floor of the facility, in each evacuation site and evacuation vehicles. Next slide, please. So lately I've been working with new providers and helping them write emergency plans and get connected with their local emergency personnel. And some providers have wanted to add or update things like active shooter policy or just adding gas, electric, and water shutoffs to their facility map. So I have some questions that I just want you to think about. Are you and your staff prepared? Have you updated your plan recently? Do you practice evacuation, lockdown, and shelter-in-place drills with staff and children? Do you have a plan to help children and staff cope after an event? So if you answer no to any of those questions and you're interested in updating your emergency plan or would like to just create schedules or checklists and agreement letters, or just maybe you have some questions. Here's my contact information, and I will be more than happy to assist you. So thank you. And now I will pass it back over to Ms. Bridget, our health equity consultant.
Thank you, Rachel. Again, my name is Bridget Banks, and I am, as Rachel mentioned, the health equity consultant for the Child Care Health Consultant Network. And I'm going to talk to you about what I do in my position. But first, I want us to think about this definition of health equity, and I'll read it. Health equity means everyone has a fair and just opportunity to be healthier. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness, lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. So there are different definitions of health equity, but I believe this one speaks to the social determinants a lot of people of color face. Basically, in an equitable classroom ensures that all Kansas children have access to quality care, and that it meets them right where they are. For that to happen, all Kansas early childhood education programs should be intentional in addressing barriers in equity and inclusion and access, and their practices and their policies, curriculum, and their environments. It is important that we check implicit biases and prejudices in our children's early learning environments. And we must remember that equity is an ethical responsibility for all professionals that are working in the early childhood education world. Next slide, please. So how can a health equity consultant help programs and providers? Well, I can work with program providers to help create healthy, equitable, and thriving ECE communities by looking at the root causes of inequities and disparities and identify any gaps that program may have. And we'll do that via a readiness self-assessment. Based on the results of that self-assessment, I can work with the provider around topics like cultural humility and responsiveness. We can recommend adjustments to create meaningful inclusion for programs and families, and also recommend recommend ways to have a culturally responsive room design so that environment is welcoming. I can even help with looking at ways to recruit, welcome, and retain families and staff from diverse backgrounds, which is very important to make sure that we're having an inclusive program. And as with all childcare health consultants, my consultations are provider driven, and I'm here to help in any way that I can. And we emphasize that it is provider driven. So based on however that provider needs and time-wise needs to work with me, I am there to help. Also, I wanted to mention that I have had the absolute honor to be able to work on a networking and supports opportunity for our providers of color. We've affectionately called it NETS BIPOC, which is networking and supports for our Black, Indigenous, and other people of color. The platform is meant to be there to allow our providers of color a safe space to bravely be their authentic selves without judgment, and to have that space to be able to talk about the challenges that they face in early childhood education that we all know is unique to them. So far, I'm happy to report that we received over 90 responses to the interest survey that we put out, and we're just really excited to get started. I cannot wait to get started and work with these providers. If you know any providers of color that you think would benefit from this opportunity, or if you feel that there is a program or your program could benefit from a health equity consultation, please feel free to reach out to me. Next slide. Here is my contact information. You can also go through our intake process, and our Child Care Health Consultant Network program assistant, Tanisha Edwards, will be able to send you my way, our way, actually. And that concludes our presentation. Thank you all so much for having us and allowing us the opportunity to share what we do with Child Care Aware of Kansas. And at this moment, we are happy to take any questions that you may have. We have a question from Erica.
I didn't actually have a question. It was me clapping because I thought
you're
you guys
clapping.
did
I'm
an
sorry.
excellent job.
Thank you so much. All right, I see Logan's hand is up.
Hey, Bridget, thank you so much for your presentation. Can you hear me? Okay, I was just checking with this headphones. I haven't talked through it yet, but I was going to ask, with kind of relation to your health equity work and your consultations with providers, I was curious because you kind of bring up, addressing social determinants of health potentially with providers. And I was curious as to how those conversations get looped into advocacy, because like thinking about, you can connect them to programs or existing resources that are there that can help them, of course. But I was curious if there ever comes to a point where you may hit an area where it's like, well, there may not be enough support here, but there should be, there should be this level of investment in this area to address a concern. So I was curious if there's a connection there, if you like make a tie-in with Tanya Cohen to get them more involved in like community group work. I was just curious of the pathways that happen in Child Care Aware. Thank you.
No. Oh, thank you. Thank you for the question. And actually, no, I haven't run into that as of yet, but as an organization, we are good about, if we see a pathway that we can pass along to, our other project teams, we do that. Absolutely.
Thank you.
Rachel, I was wondering, what are some of the common areas that you run into when you're conducting visits or you're offering assistance? Are there certain things that people either don't consider, or you do a lot of a certain type of emergency preparedness planning? Yeah, what's common?
Oh, I think that's for Rachel. Okay.
Well, actually, right now, I've just been helping the new providers mainly get them started, and just helping them with their plan, writing it out, and giving them ideas that they can do to make their site safe. Our providers that are already started, a lot of them have wanted to add like active shooter. That's been like one that we've been working with a lot lately. And just trying to figure out ways to keep their site safe, just locking the doors. So lately that's just what we've been going through.
I also have the $1 million question. So we have each of your specific contact information. What if somebody doesn't know what they need? So they know that they need a health consultant, but they're not necessarily sure which function or what they should start with. Is there where do they go with that initial request?
We do have a needs assessment to just 17 questions just to see if we can spark some ideas, or and also I have a risk matrix that just trying to see what things would affect your area. Like if you have high criminal activity in your area, and then just go from there. What steps can you do to keep your site safe? If you're across the street from a gas station, there could be a chemical leak. So just having a plan and working on steps to keep their site safe. So we do have those two things that we start out with, and then we just go on from there and set goals.
And I would just add, if there's a program that is not quite sure which direction they want to go, whether or not they need a nurse consultation or if they need a health equity consultation, or if they just need a health with wellness and safety consultation, they can just go to the website and go through the intake process, and our program assistant will get them to the right consultant. And I see that Brenda has her hand up.
Hey. Hey, Ms. Bridget, thank you so much for this. This is a great presentation. I just wanted to mention one of the resources we dropped into the chat for caring for the breastfed infant during emergency preparedness. We found in our childcare section that there was often missing information around emergency preparedness and the breastfed infant. So our section put together some things to think about in a checklist. So I just wanted to point that out, because so often when we think about infant care and emergency preparedness, it seemed like many of the assumptions were that they were formula fed. And so we were just kind of thinking about, this, now that we're having more infants being breastfed, we thought it's time to have a list for that.
Yes, Ms. Brenda, and that's also on our self-assessment to see, do you have coolers and do you have ice packs and ways to heat up the milk? So, and when I get to that question, a lot of them, oh, I didn't think about that. So, yes.
Exactly. That's great. Well, thanks, Rachel, for it's nice to hear that that's on your list. And we're here to help if any questions come up that you're not able to answer around that. Thanks.
Thank you.
Bridget, my last comment, and then I will stop harassing both of you. So super excited to hear about, did you say it was NET BIPOC?
NET, we're calling it NETS BIPOC for now.
That's BIPOC.
Yes.
So very excited to hear about that. I think that's fantastic. It sounds like it's in its infancy as far as trying to figure out maybe the themes or what's needed. But I, for one, would love to hear, if you're able, even anecdotally, what some of those barriers have been, or kind of what people have reported in that survey that you guys sent out, that first response, like as individuals, how can we be cognizant of that? And I know that you're in the early stage, but just anything you could share would be helpful of how we can be more supportive to those specific needs.
Yes, I will definitely, that's my plan, that as we move along a little bit further with it, because some of the responses that I've gotten have been very eye-opening. We definitely know there's a lot of trust issues that we need to mend. So I'm hoping that as we move forward and we get a chance to actually get deeper into those conversations, that I will be able to share out and kind of give a report on how that's going respectfully to them.
Well, absolutely. And any of the vehicles that we have, whether that's the biweekly webinar, stakeholders, any vehicle that we have that we can assist you with, please let us know. We are more than happy to assist in that. We're very committed to equity, and I've seen you in other equity-driven endeavors, but I love that this is your position, and yeah, you're great for it. So happy to hear about what you guys are doing.
Thank you so much. I appreciate it. Thank you.
I am not seeing any other questions. I'm going to roll forward. And if we have questions, I will stop and we can raise those with the ladies before we lose them. But just a few reminders. So our next early childhood recommendations panel meeting is next Friday, so August 19th, 9 to 11:30. It's always the third Friday of the month. Our next bi-weekly webinar is 2 weeks from today, same place, same time. And as always, if you have something that you would like to share or your agency would like to share, maybe a new initiative or an update on an existing initiative, specifically, we find that things that are directly related to the strategic plan or PDG efforts, people really like to hear about those. We know there's so much great work that's happening in our infrastructure, but when you're working hard and driving forward, it's hard to sometimes raise your head and look around and know what else is going on. So this is a great way that we can kind of tell each other what's going on. Our full Kansas Children's Cabinet and Trust Fund meeting will be October 7th. That's in the morning, followed by the early childhood group in the afternoon. So if you have content for that early childhood formally stakeholders, you can get with myself or Megan Broha, and we'll be more than happy to accommodate. So I'm going to check this chat one more time. And it looks like we are okay on questions. Childcare Aware and the CCHC, thank you so much for being here with us. We appreciate it. I really love these CCHC presentations because they're so tangible. But yes, so good luck in all of your ventures. And if you and your littles are back to school this week or next, good luck. Congratulations for the peace in your home and also the incoming chaos. So we will see you in 2 weeks.
Thank you.